Malaria is a dangerous disease. It affects millions around the world. This serious illness is caused by a parasite. The parasite is called Plasmodium. 5 different types of Plasmodium parasites can infect humans. Each species can cause different symptoms and severity of illness. However, all types can lead to severe health problems if left untreated. Malaria is spread through mosquito bites. These are not just any mosquitoes. They are infected female Anopheles mosquitoes. These mosquitoes thrive in warm, tropical climates. Malaria has plagued humanity for centuries. Its history is intertwined with ours. Understanding this disease is the first step in fighting it. Malaria spreads through a specific mosquito species. The Anopheles mosquito carries the Plasmodium parasite. When an infected mosquito bites a human, the parasite enters the bloodstream. Inside the body, the parasite travels to the liver. Here it multiplies and develops into another form. After some time, the parasites are released into the blood again, this time infecting red blood cells. The parasites multiply within the red blood cells. This cycle continues, leading to more parasites in the blood. This is when a person experiences malaria symptoms. Knowing how malaria spreads is crucial for prevention. By targeting mosquito breeding sites and using personal protection, we can break the chain of transmission. Malaria is a global health concern. It disproportionately affects poorer regions. Sub-Saharan Africa carries the heaviest burden. According to the World Health Organization, nearly half of the world's population was at risk of malaria in 2022. An estimated 247 million cases of malaria occurred worldwide. The vast majority of these cases, about 95%, were in Africa. Tragically, malaria caused an estimated 619,000 deaths in 2022. Children under 5 years old are most vulnerable. Malaria remains a leading cause of childhood mortality. These numbers highlight the urgent need for effective malaria control. Global efforts must focus on prevention, diagnosis, and treatment to reduce the disease's impact. Malaria's effects on the body are severe. After a mosquito bite, there is a period before symptoms appear. This is the incubation period. It can last between a week to a month, depending on the parasite species. Common malaria symptoms include high fever, chills, sweating, headache, muscle pain, and fatigue. Some people experience nausea, vomiting, and diarrhea. If left untreated, malaria can lead to life-threatening complications like anemia, organ failure, and coma. Diagnosis is crucial for timely treatment. A blood test can confirm the presence of the parasite. Once diagnosed, anti-malarial medications are used to kill the parasites. The type of medication and treatment duration depend on the parasite species and the severity of the infection. Early diagnosis and treatment are essential to prevent complications. Access to reliable healthcare and effective medications are crucial in the fight against malaria.